Yesterday, EFCC committed an abomination in Akwa Ibom State. Professor Eyo Ekpe was washing in for a surgery that he never did. Why? Because masked men from the EFCC entered the hospital, took out tinted bus and fired tear gas inside the hospital. Patients ran, nurses ran, people on drips ran. According to NMA, that's the Nigerian Medical Association, they beat this professor until he was bleeding from his forehead. Handcuffed him, dragged him outside the hospital with 3 other staff. Why? They wanted to verify medical reports. A piece of paper for somebody that committed fraud. Now, the EFCC has come out to say, we wrote 2 letters, but we didn't get any response. Fine. Let's say that that's exactly what happened. Let us assume that the hospital ignored every letter. Tell me, in what country does an unanswered letter justify tear gas in a ward? In what world does the answer to "we are not replying your emails" become poop marksmen with 2 buses into a place where people are fighting for their lives? There's a thing called court order. There's a thing called subpoena. There's a thing called the rule of law. None of these things require beating up a medical practitioner. And here's the thing nobody is even saying. Here's the part nobody is even saying. This Professor Ekpe had a patient on the table. We don't know that person's name. We don't know if they have children. We don't know if they made it. But we already noticed that the person is already a casualty. This person is one of the casualties of yesterday. Let me also tell you other casualties. Every other single patient who was supposed to be on the surgeon's list this week is casualty. The pregnant woman was supposed to be wheeled into a different theater when tear gas was fired in the corridor is already a casualty. The dialysis patient who could not get his dialysis done yesterday because staff scattered, casualty. The newborn in Niku, whose nurses ran to abandon them because of they are trying to save themselves, casualties. When you attack a hospital, you're not just attacking one man. You're injuring everybody he was about to save. You're injuring every other doctor in that building. It's simple maths. Simple. But there's even the longer one. We have less than 80 cardiothoracic surgeons for 220 million Nigerians. Other countries like USA has over 4,000 for 330 million people. Uyo has only 1, which is this particular surgeon. The entire state has lost its surgery capacity in 1 afternoon because of the EFCC. So when a young doctor in Abuja is seeing this video now, 28, what do you want them to do next? Open their laptop and jackpot. We've lost that person too. We're not just losing Professor Ekpe today. Oh. Yes. We're losing every other person, every other doctor who has watched this and decided that Nigeria is not safe for them anymore. How many doctors do we have in this country? So when your father has a heart attack at 3 a.m., when your sister goes into cardiac arrest during surgery, when your child is born and there's a hole in the heart, God forbid that be, is not our portion. Who do you think will be in the theater? EFCC? Or the surgeon that they chased out of the country? This is not even about EFCC versus doctors. It's about whether Nigeria still has the basic decency to treat a hospital like a hospital. So I'm calling on these people directly. Number 1 is the chairman of EFCC. Olanipekun Olukoyede. Discipline the officers who led this operation publicly. Not a quiet redeployment, not a public sanction. Apologize to this professor, to UUTH, and to every Nigerian who has watched their hospital turn into a war zone. Then publish your agency's standard operating procedure for engaging with health institutions. So this thing like this will never happen again. To the Honorable Minister of Health and Social Welfare, Professor Muhammad Alipate. Hospitals must be declared protected zones in law, the same way we treat schools and places of worship. Bring the bill and the medical community will stand with you. To the President, your administration cannot ask doctors to stay when our agencies are hunting them inside our own theaters. 1 word from you fixes this. We are waiting for that word. The enemy is currently on strike in Akwa Ibom as we speak. Patients are being turned away from a hospital. People whose life, the cost of yesterday is already being counted in lives. The longer this drags, the higher that count goes. We cannot save Nigerian lives if the people trying to save them are not safe in the same building that we built for them to do that work. Respect the hospital, respect the white coat. Everybody will leave.